Identify the instrument. A. Elizarow's fixator. B. Rail fixator. C. K nail. D. Proximal femoral nail. What do you think is the correct answer here? The correct answer here is B. Rail fixator. Identify the given splint. It is a cock-up splint. So the correct option here is cock-up splint. Now we will see the different types of splints. Cock-up splint is a static wrist orthosis. Can be used in wrist pain, Colles fracture, carpal tunnel syndrome, wrist drop, and hemiplegia, de Quervain disease. Then dynamic finger splint, knuckle bender splint. Knuckle bender splint simultaneously flexes the MCP's metacarpophalangeal joint of all digits without blocking interphalangeal or wrist motion. It is used in case of ulnar nerve palsy. Knuckle bender splint is used in ulnar nerve palsy. A football player falls on the outstretched hand while kicking the ball and felt pain at wrist joint immediately after falling. It is a Galeazzi fracture. Now we will see what is Galeazzi fracture. Galeazzi fracture is a fracture of lower one-third of radius and dislocation of distal radioulnar joint. Mechanism of injury is fall on the hand, probably with superimposed rotation force. Radius fractures in its lower third, and inferior radioulnar joint subluxates or dislocates. Clinical feature: it is more common than Monteggia fracture. Striking feature is prominence or tenderness over the lower end of ulna. It may be possible to demonstrate the instability of radioulnar joint by ballotting the distal end of ulna, which is known as piano key sign, or by rotating the wrist. So the correct option here is Galeazzi fracture. What is the use of given instrument? It is used to hold the bone and plate. Earliest sign of compartment syndrome of leg is D. pain on passive stretch. Pain on passive stretch. Why pain on passive stretch? Compartment syndrome. It is more common in lower limb. High risk injuries, fractures of elbow, forearm bones, proximal third of tibia, multiple fractures of hand or foot, crush injuries, and circumferential burns. Clinical feature characterized by pain with passive motion of fingers and toes, pulselessness, pallor, paresthesia, poikilothermia, and paralysis. Pain of out of proportion to clinical situation is usually the first symptom. Pain on passive stretching is most sensitive prior to onset of ischemia. Late signs of compartment syndrome are paralysis and pulselessness. Diagnosis, stretch test, early sign of impending compartment syndrome. Elevated compartment pressure. If delta pressure, treatment, emergency fasciotomy to decrease the pressure and increase the tissue perfusion. Earliest sign of compartment syndrome of leg is pain on passive stretching of toes. So the correct option here is D. What is the most common sequelae of traumatic shoulder dislocation in young adults? It is recurrent shoulder dislocation. Correct option is B. In the fracture seen in X-ray, what is the most commonly expected? It is a supracondylar fracture. Brachial artery is involved. What is the eponym for fracture? It is a Monteggia fracture. An athlete suffers a fracture shown in the knee X-ray below. How is this fracture managed? This fracture is managed by tension banding wiring. What type of fracture it is? Anybody? Any guesses? It is a displaced transverse fracture of patella. Displaced transfer or fracture of patella, which is treated by tension banding wiring. Which part of second metatarsal is involved in Mars fracture? It is neck part. Which of the following is incorrect about PCL? It is a main restraint to internal rotation. About giant cell tumor, all are too commonly presents in 20 to 40 years of age. Matrix consists of proliferating mononuclear cells. Osteoclast giant cells constitute the proliferative component of tumor. It is a benign tumor which have lung metastasis. All are true except C. Giant cells constitute the proliferative component of the tumor. Why? In giant cell tumor, the osteoclast cells are the malignant cells which induce the proliferation of mononuclear macrophage linear cell. Hence, the dividing cell population is the mononuclear cell which forms the matrix. Osteoclast giant cells do not constitute the proliferative component. So the correct option here is C. What is the diagnosis? It is a giant cell tumor. Deformity. It is a swan neck deformity. Glucosamine supplementation is given in A. Arthritis. Patellar lung syndrome scar is present at superior polar pattern impinging the question number 16. Impinging on the femoral component during extension. Correct option here is femoral component during extension. Patellar clunk syndrome. Patient complain of a clunking during knee flexation caused by suprapatellar fibrous nodule that interferes with patellar movement. Many patients can be managed without surgery. However, if there are persistent symptoms, surgical excision of nodule can be useful. Irritation of the lateral facet of patella. Contact between the lateral facet of patella and the femoral implant in the region of lateral condyle can cause chronic lateral knee pain. So the correct option here is B. More specific for diagnosis of ankylosing spondylitis is bilateral sacroiliitis. Which are the following most likely cause of abnormality seen in cherished X-ray of the child below? It is rickets. "75-year-old female had a fall and had intertrochanteric fracture. This is due to osteoporosis. A 55-year-old male presents with severe backache for 10 days and urinary incontinence with a history of intervertebral lumbar disc collapse. There is no history of fever or weight loss. What is the likely diagnosis? It is Cauda-Equina syndrome. Now, what is Cauda-Equina syndrome? What is Cauda-Equina syndrome? History of severe backache, urinary incontinence, intervertebral lumbar disc prolapse without any fever or weight loss is highly suggestive of Cauda-Equina syndrome. The spinal cord terminates around the level of L1, so compression here may involve the conus medullaris or the cauda equina, or both, giving a mixture of upper motor and lower motor neural lesions. The typical cauda equina syndrome consists of lower limb weakness, absent reflexes, impaired sensation, and urinary retention, with overflow perhaps mimicking incontinence. Cauda equina syndrome is characterized by low back pain, diminished sensation over the buttocks and posterior superior thighs, perineal area in a saddle distribution, rectal and bladder dysfunction, absent bulbo-cavernous reflex, patellar and Achilles reflex are also absent. So this is cauda equina syndrome. All of the following are true about Sprengel's shoulder. Sprengel's shoulder, elevation of scapula, most common congenital abnormality. Sprengel's deformity is usually noticed at birth. Asymmetry of shoulders with elevation and underdevelopment of affected side. Scapula is abnormally small and too high, associated with hypoplasia or atrophy of the regional muscles. Elevated scapula is usually noticeable with restriction in the motion of scapula. Occasionally, both sides are involved. Now, what are the association of Sprengel's deformity? Klippel-Feil syndrome, spina bifida and diastematomyelia, kyphosis or scoliosis, torticollis, underdevelopment of clavicle. Treatment is required only if shoulder movements are severely limited or if the deformity is particularly unsightly. Best age of operation is before 6 years of age. The correct option here is usually associated with dextrocardia. Diagnosis of image, it is Coxa-Vara. A neck shaft angle of less than 125 degree is referred to as Coxa-Vara, where the neck normally aligned relatively to pelvis. The limb would be deviated towards the midline of body in varus. A neck shaft angle greater than 125 degree is called coxa valga. Coxa vara means reduced neck shaft angle less than 120 degree. Coxa valga increased neck shaft angle more than 135 degree. Coxa saltans, also known as snapping hip, caused by motion of muscles and tendons over bony structures around the hip joint. Coxa magna is asymmetrical, circumferential enlargement and deformation of femoral head and neck. Coxa Coxa-Vara is used to describe reduced angle between neck and shaft of femur. It can be congenital or acquired. Infantile Coxa-Vara. So the correct answer here is Coxa-Vara. Meralgia paresthetica is due to involvement of lateral cutaneous nerve of thigh. Deformity given in the given picture. It is hallux valgus. Haglund's deformity is seen in which joint? It is seen in ankle.